It's another Tuesday, and I am more than happy to be here with you, our ardent listeners, for this week's episode of Healthier You, right here on Radio Maria 91.3 FM, the voice of truth. You are most welcome to our package today on the show, and we hope that you would have learned something new by the end of our program today. Good evening. I am Ekene, and of course, I'm not doing this alone. As usual, I'm with
Stephanie. And once again, welcome to today's show. We are glad that you are able to join us in. Remember, we are on YouTube, so please feel free to check us up on our channel, Radio Maria, Nigeria-Abuja. We would like to wish you a happy new month from Healthier You on Radio Maria. And we also hope that you're not stuck in the hold up
and a crazy couple
or
of days.
fuel queue or something. You know, we know the stress is just a lot already. That's why we're telling you, just be healthy. Just be healthy.
Anyways, so today we'll be talking about vision and its importance in learning. As stated by the American Optometric Association, the AOA, up to 80% of a child's learning in school is through vision. Also, in keeping with its 2015 statement from the College of Optometrists in Vision Development, more than 5 million children in the United States have eye coordination and eye focusing disorders, which cause them to continue struggling with reading despite the best interventions. Children do not know that they are supposed to see, so they rarely complain. They show us they have a problem with their behaviors.
Okay, that's why on today's show, we have decided to bring you the little things you need to understand to actually notice and know that, okay, your child needs to see. Okay, even if you don't even see or know, you should know that your child needs to see the optometrist. So today on the show, we have invited as our guest today a seasoned doctor, Dr. Damian Echendu. He's an ocular health and behavioral optometrist. He is also the past president, Nigerian Optometric Association. So you believe me today when I say that when we're going to talk about vision today, we have somebody in the house who's going to do justice to the show.
Sir, can we meet you, please?
Yeah, thank you very much, and thanks for having me. Just like she said, my name is Dr. Damian Echendu. I've been in practice for over 28 years, and I'm a past president of Nigeria Optometric Association, and ocular health and behavioral optometry, just like she has said. And
Okay.
I'll take it from there.
You're welcome, sir. As they will say, he's an OG in the field.
Okay, he's well seasoned.
Okay, we'll be going on a short break now. When we come back, we'll unpack the topic of today, which is our vision and its importance in learning. Please don't touch that dial.
Back to Healthier You on Radio Maria 91.3 FM, the voice of truth. If you're just joining us, we're going to be discussing the topic, our vision and its importance in learning, with our guest in the studio. And also would like to remind you that the phone lines will be open 30 minutes into the show. And our phone lines remain 081 084 475 18. I repeat, 081 084 475 18. You can call in to ask your questions, make your observations, additions. You can also send your SMS and WhatsApp messages to this line.
So, Dr. Damian, with your wealth of experience, I'm sure you're loaded for us today. So let's get started. The topic, as we said earlier, is vision and our vision and its importance in learning. So let's start from the first part, which is vision. So normally with vision, I think to the layman will probably be, are you seeing? And then for those that maybe have some form of medical or maybe examination, they will think it's the 20/20 that you see when you go to the doctor. So, but from your point of view, what is the vision? Like, if you can give us a technical definition of vision.
Yeah, thank you very much. Vision, just like you said, has been used in different ways by different people. There are different definitions of vision, and people use it interchangeably with eyesight. It's quite different from eyesight.
Okay.
Eyesight is the ability to see, the clarity or the sharpness of vision. While vision is much more than this. When you talk about vision, you talk about the brain playing a part vision, technically or in the ordinary sense, could mean deriving of meaning with the direction of action, which is triggered by light.
Okay.
For instance, it means three things. One, there should be organization of things,
Okay.
there should be understanding of things, and then there should be direction of action. So for vision to take place, one, the things that vision is going to see or the eye is going to see must be organized, it must be understood, and then there must be direction of action. These three things makes vision.
Okay, wow.
And when you talk of eyesight ordinarily, that's what most eye care practitioners measure. And when a patient comes to the clinic, they usually measure what we call visual acuity. Visual acuity is measured or graded based on ability of a patient to see lines of letters or target placed at some distance. And but you find out that ordinarily vision for a child, for instance, does not really take place at distance. Most of the time, it takes place at near. So I'm just relating it with respect to learning. And learning, of course, we know what learning is all about. Learning is acquisition of knowledge. And when a child or a person goes to the clinic and vision is measured at some distance, they don't usually take into cognizance what happens at near. So for the part that the patient or his child is seeing a 20/20 vision or 60 vision, which they take as normal vision, does not mean that the patient actually is seeing or they has good vision. So good vision is much more than having clarity of vision or sharpness of vision or sharpness of sight. So it's much more than that.
Okay, so Doc, if I get you, you just did a clarity for us that eyesight is different from vision.
Yeah.
Someone can have a good eyesight
Without having
without having a vision.
Yes.
So let's get it clear. For those of you who say that you see everything far away, there's a difference. And then from what he has also explained concerning the direction, understanding, and organization, you see that vision is more or less more behavioral, like organized and all that,
exactly.
So there's actually a difference from what we see, because I'm sure when we started the topic, everybody's like, what's vision and learning again? I'm seeing now, why wouldn't I learn? So I think Doc has been able to differentiate it for us now, that not necessarily that you're able to see means that you're able to learn, because you will not have that package of vision to be able to understand. But thank you, Doc. That's a new one.
That's a new one, actually. Yes. It's a new one. So can we now talk about why? I mean, oftentimes we've heard of eyesight and all, or according to what you just told us, we now know that what we've known all along as vision is eyesight. Yeah. So can you now tell us why vision itself is so important to us?
Yeah, vision is important to us in the sense that, one, more than 80% or between 75 and upwards percent of what we do in life or learning process involves vision. More than 75% of what we learn or what a child learns involves vision. Okay, even ordinarily, balance, walking, all involve vision. If you close your eye, if a child or even an adult close your eye, if you close your eyes now, if you stand, let's say for instance, you stand on your foot, one foot, and then you keep your eyes open, you have balance. You just stand on your foot and then close one eye, close your two eyes and see what happens. You lose balance. Yeah. So it's also vision. There's about 20% of balance, or what we do in life, balance, especially balance and coordination and body movement, is contributed by vision.
Okay. So Doc has just made it clearer for us. We're speaking English, but in the practical terms now, he has made something very clear that, like just the example he gave, and it has really, pushed in the word to let us know the actual difference. Okay, like when you close your eyes and open it, and you see that your vision is helping you to. That does not mean you don't have the eyesight, but the vision is what is helping you to balance. Thank you, Doc.
And also, vision has to do with the brain, and the eyes, and then the nerves that connect the brain and the eyes. These three entities must work as a team in order for somebody to have vision. And in vision, I just stated before, if somebody can have sight without actually having vision, you need to really understand what you are seeing, be able to interpret it, be able to direct action.
Yeah.
So with vision, vision can show you something and also make sure to show you how to do it.
Okay.
Are you getting me?
Yes.
So
You
please,
can-
you are getting us. Let's
No,
understand.
let's say vision can say you see this now. Vision can make you to see things, or this is work to do, and also show you how to do that work.
Okay.
Okay?
Okay.
Yeah, because you have to use your brain to
Okay.
think about it, because you have seen it with your eyes, and both your eyes and your brain will work together in order to achieve your purpose of what you have seen. Yeah.
Okay. Clearer now.
It's clear. I mean, that's a whole lot of
You
things.
know, that you see, when you see his qualification, you see that he's an ocular health and behavioral. So now we are getting to understand that behavior is also associated with
Vision.
optometry and
Yeah.
vision.
Yeah.
You know, so wow.
Because I mean, it's quite important what you said, that vision lets you know what to do, and then how to do it. Because you normally associate how with like the motor function and stuff like that. But I
Cognitive
mean,
factors
exactly.
and all that.
Yeah.
That's quite interesting.
Yeah.
So let's now talk about children.
Okay.
And you know that the children, they go through various stages in their development. What's the role vision plays in the development of a child?
Yeah. A child, when a child is born, vision. Okay, let me start from vision is learned. Just like we learn how to walk, learn how to crawl. Also, vision is learned. No child is born with good vision.
Oh wow.
Okay, no child is born with.
So vision is a behavior.
Yeah, it's a behavior. You will learn it. The child learns how to see. Okay? So these are things that develops over time as a child is.
So it's not like you're just born to see.
Yeah, no.
Oh, wow.
So that is that
Please, let's confess something. Does it have to do with that when they say when you just give birth to a child, he's not seeing you, you now do your hand like
yeah, actually.
try to show, and the child is not blinking. I say at that point not be seeing or something.
Yeah, you see, when a child is born, let's say the pediatrician will make sure that the child's eye is checked to see whether there are any abnormality, other congenital abnormality that is present that could obstruct vision development.
Okay.
Are you getting that? So vision develops as the child gets older. When a child is born or an infant, you find out that the central vision is not developed. The child basically might be seeing something around, maybe very, very close with the peripheral vision. So as time goes on, within the next 1 month, you find out that the central vision, which is the vision area that we use for keen vision, start developing. Initially, a child can only see about, an infant can only see about 8 inches.
Okay.
When, something, or your mother or the parent brings these are very close. Yes. So in the next 2 months, you find out that this child the vision development start going on, and then you find out that from there maybe about 12 inches, 3 months, about 14 inches, and it goes like that. And the most important is that the critical point is between between birth and 6 years. This is the most critical part of vision development. So every child must be checked at birth, and also following years to ensure that the vision is developing properly.
Do we do that here?
Yeah. Well, if you go into literature, you find that it's done in developed countries. Here, few places they do it, and that is why we actually go online. Media to ensure that we educate people, educate even some practitioners to ensure that some of these things are done.
And if I must say, if at birth, these things are actually well checked, okay, it will go a long way to preventing a lot of congenital issues and all that, and not
and
actually prevent it, but help you to nip it and understand that this is what you're actually born with.
If you dictate it early enough, it can be addressed. But if you don't dictate it early, it could actually get worse and lead to more problems, more severe vision loss, can lead to vision impairment as time goes on. So that is why at birth it's checked. Before 1 year, the vision is also checked, and then at 2 years, should be for the child preschool, the vision should also be checked. Yes, in as much as the child might not be talking at that time, there are special tests that could be done to check whether a child is seeing or not. Vision is important for a child because it's the vision that helps motor development. motor development, like, of course, motor also direct vision to develop. Like a child is born, and once the child is kind of wandering, when the child at infant, you find out the eyes wanders, it's not focused. One might be going different direction, the other one is going different direction. But as the child is getting older, I find out that the child start developing better vision, the eye muscles, everything starts straightening, and the eyes start moving together, going out and coming in together. So at that early stage, any problem that or a practitioner cannot detect at that particular point could actually get worse as time goes on. And there's a period at which some of these conditions, if not detected, could actually cause vision impairment, and it would be very, very difficult to actually ameliorate them later on in life. So vision for a child is very, very important. Just like I said, for motor development, reaching out for things, moving the eyes, perceiving depth, being able to know where he or she is in space. It depends on age, okay? So interpreting, knowing, recognizing the parents, knowing when something is dangled in front of, and then being able to respond to things in the environment.
One that is very important is looking at the fan.
Yeah, looking at the fan. And at times
very common with children.
And you find out that you might be playing with a child and show a child something that's brightly colored, and then you hide it somewhere, put it in and cover it. The child will start looking for it. These are the things that vision does, and it helps in overall development of a child. So you can imagine a child that is not seeing very well, and you send this child to school. One question I want to ask parents is that do you ask yourself, have I prepared my child enough to go to school? Okay. You parents will be busy buying books, buying pencils, going for dental exam, have you been able to find out whether the most important aspect of learning or that helps this child to learn in school has been checked and whether it's in proper condition?
And another thing is, parents, if you're hearing us, these days in schools, they will tell you to bring test results, genotype this and all that. Yeah. Like what Doc is saying, I think vision should be included in it.
I think when they even say vision, I think it's just the 2020 vision.
Yeah.
Yes, most times they don't even ask. If at all they do,
So from there we'll go on to just what you just said now about 2020 vision. So you find out that that's what actually happens with most schools. They send their pupils that are entering school newly or even those that are going to secondary. Most times it's those that are going to secondary school that you see. But the younger ones, the infants, the preschoolers, those in grade 1s and grade 2, hardly do they ask for that. You find out that when it's usually asked, it's usually almost late. Those that are entering secondary school, the school will ask, go and do medical checkup and all that. And then when they go to the clinics, what they do is they test their eyesight. And the eyesight is usually done at distance. Those basic skills that require that near, like focusing skills, teaming skills, which we are going to talk about later, tracking skills, perceptual skills, which is some of the components of vision that's supposed to be present, and that helps in learning, might be lacking. And once it's lacking, no matter even if the child is seeing 6'5", the child will not develop well academically. Not just academically, vision is also important in sports. You find out that you go in developed countries, you see some of Magic Johnson, all these sports, Ronaldo, when they play football, they play a free kick, it goes into the net. You ask, why do they play free kick like this? And it goes, it's because this people's eye and hand and leg coordination is perfect. And they are working as a team. But you find out that a child that's having vision problem, if the two eyes are not working as a team, they see things differently. They will not be able to perceive depth. They will not be able to locate themselves in space. Okay? And if you ask them to maybe give them something to trash, instead of trashing in the dustbin, they trash it outside because they cannot perceive that depth.
Wow.
Okay.
It's an interesting one. We'll be going on a short break now. I think we've already talked about a lot of things, so let's take some time to take that in for now. So we're going on a short break. When we come back, we'll continue the topic of the day, which is our vision and its importance in learning. Don't touch that dial.
Welcome back to Healthier You on Radio Maria 91.3 FM, the voice of truth. If you're just joining us, we have been discussing vision and its importance in learning. And with us in the studio today is Dr. Damian Echendu. He's an ocular health and behavioral optometrist, a past president, Nigeria Optometric Association. And so far, he has really put us through a lot. He has been able to clarify what the difference between eyesight and vision. And he has told us that eyesight is just the ability to see, and the clarity of vision, like, okay, this is near, this is far, and I'm seeing it. But then vision is the more elaborate, advanced form of that. He has told us that vision involves organization, direction of action, and the understanding. So in essence, what he has told us is that vision is coordination. It has to do with the behavior, the cognitive factors coming together, the brain, the nerve, and the eye coming together to be able to perform a particular act. And today we've been talking about it, and we've been talking about the children and how they develop, and from stage to stage. And he has told us how important it is actually to be able to check these children, okay, when they're entering into school. He has even warned that we also need to prepare them properly, because it's when they have the right vision that they are able to learn properly. So Dr. Echendu, thank you for joining us, and thank you for thus far you have opened our eyes to the difference between vision and eyesight.
Yes. So Doctor, from our the last question, you had mentioned something about skills, the visual skills. So let's just go into it now. So what are the various visual skills, and first of all, when we say visual skills, what do we mean? And then what are the various visual skills that are necessary for learning?
Sorry, Doc, before you delve right into that, let's call our phone lines again, which will be open very soon. While the doctor is talking, I'm sure you can start calling in, sending your SMS and your WhatsApp. And please keep it in line with what the topic is, which is vision and learning. Okay, so our phone line remains 081 084 475 18. Again, 081 084 475 18. Please call in if you have contributions to make, maybe on your child and complaints, and so that you're making contributions for others to hear exactly the practical terms of what we're talking about. Send in your SMSs and your WhatsApp.
So, thank you for that, Doctor. So can we go ahead?
Yeah, we just asked about visual skills. Visual skills are the skills that are required for good vision to take place. Okay, and basic skills that is very important. One is the eyesight, is a skill to see, ability to see, and then which is usually measured, but it's just is one of the components of skills that is required for good vision. Other skills include teaming skills. Teaming skills have to do with divergence, the ability of the eyes to go in and to go out as a team. Each eye sees things, independently. But what happens is that when the information gets to the brain, they come together, they form one single image, which is projected out there. So ordinarily, the two eyes need to work together as a team. A situation where one eye is focusing at different point and the other one focusing at different point creates a disunity of information that goes to the brain.
Okay.
And in that way, or in that process, information is distorted, and the brain gets confused, and information processing will be slowed. So, for each eye should focus at the same point. Both eyes should focus at the same point.
Okay.
For a single image, clear image to be seen.
Okay, so I want to see this microphone in front of me now.
Yeah.
I would have to have my two eyes focused on it.
Let's say you are reading a word or a sentence.
Okay.
For you to see road, for instance, the two eyes must focus on that road. If you focus on that road, you find out that everything by the side of it will blurred. Yeah. Okay? So in a situation where one eye is focusing on road and the other one is focusing on vision, you find out that the two information will be, each one will send vision to the eye, the brain, the other one will send road to the brain. Both of them will not be able to come together, to fuse together. So, so it's important for the two eyes to work as a team, what we call teaming skills. So, And this teaming skills is learned as a child develops, as a child gets older. It's not there at birth.
Okay, sorry, Doc. We have a caller already.
Good evening and welcome to Healthier You on Radio Maria. What's your name and where are you calling from?
Hello, good evening. Are you there?
I think we lost that.
Okay, please do call back. We've lost that. Guess it's network. Please call back.
So probably I will use the opportunity to also say some of the things that can happen when there is deficiency in teaming skills. A situation where a child or an adult cannot get the two eyes at the same point. As he or she reads, you find that it takes a lot of energy and not effort for him to focus. And in that process, it can lead to headache. It can lead to blurred vision. Okay? It could actually lead to slow comprehension, that leads the child to memorize or to understand what he or she is reading. So it's very, very important for the two eyes, we call it the binocular system, to work to work together as a team. I can go ahead?
Yes, you can.
Yeah, you can see what we've been talking about. We are talking about teaming skills. I made mention of if the two eyes are not working as a team, you take a lot of effort to see.
Okay.
And in the process, water can come out.
Chinedu, if you're hearing us, you're just right on point, okay? Because it's actually what the doctor is talking about that you're complaining about.
It could be the cause, it may not be the cause, but this is one of the things that can lead to that. And if you're not seeing very well, if the two eyes are not sending the same information to the brain, it takes you a lot of effort. And in the process of straining your eyes, of course, water will come out.
Yes.
Your eye might even become more sensitive to light at times, and things will get blurry. And if you know very well, once water comes out from your eyes, in one eye for instance, it has changed the what we call the medium through which light passes.
Okay.
And that could blur your vision as well. Okay, that is why you don't see water coming out or flowing like that. Once the tears or is produced, it's drained through a process and keeps the eye, keep the eyes clear so that you see better. So once there is any obstruction, even ordinary tear flowing in the eye could add, if you pour water on your eye, you find out that eye you pour water on will be blurry ordinarily. So there are so many factors, there are so many things that can cause that. But you need to have your eye checked.
Of course.
Yeah, to find out what actually is causing that.
So
you might go to a eye clinic and they will just check your vision and say it's okay. But they also check other skills that requires for reading.
Yes.
To know whether it's actually
you're doing it rightly.
Yeah.
Well, Chinedu, the doctor has given you one of the possible causes, and I think it's just skill.
Yeah.
So I think the other part is to make sure you go to a qualified doctor to get that examined.
Yeah. Then we're talking about other skills. We have the focusing skills or accommodating skills. In focusing skills, also it has also to do with ease of getting the eyes to focus on a particular object or a particular target. So in the eyes, there's what we call the ciliary muscles, or the muscles that helps the eyes to accommodate, to kind of contract and relax, to make sure that you see things clearly. Apart from converging, the eye can converge. You can converge the eye at a point, but without seeing clearly. It's after you converge that you focus on that. So there's these focusing skills that should a child or an adult should have, that will not require you to make a lot of effort for you to see. You don't ordinarily need to experience it when you do it, but ordinarily you are doing it, you are focusing without feeling it. But when it comes to a point when you actually strain yourself to focus to see that, that's when there is a problem. So such skills is very, very important in learning. Okay. And some eye tests also don't look at this. And that is why some children actually have academic issues with when they have vision problem, which has not been detected much earlier. Okay. Other skills include tracking skills. Tracking skills, a child or an adult should be able to track one object, a word to the next word, or track an object from one point to the other. If you are reading now, there is ability for you to read smoothly and accurately. A situation where you are, along the line. You know, there's a lot of things you are doing when you are reading. One, you are looking at the word, you are focusing at the word. You're also trying to understand what you are reading. Yeah. also the speed at which you are reading. There are so many things that you put into consideration. So reading is not just it's a complex process. It's a complex process. So tracking skills is very, very important. A situation where you read a child or an adult read, the reading is not smooth, is not accurate, it could lead to a lack of comprehension, it could lead to jumping of lines, it could lead to jumping of words, it could lead to a child who asks a child to read, instead of reading with the eyes, start pointing, using the hand to trace it. Okay? Or when the child is reading, try to move his head, when that child is supposed to be using only his eyes to see. So these are one other skill that's that's tracking skill. Other skill that is important is what we call the perceptual skills. Perceptual skills have to do with spatial orientation. You see, it has to do with identifying some letters that look alike. Like you might show a child B, instead of calling it B, the child will call it D. Okay? Or you see run, instead of calling it run, you call it rum. Or you show a child a P, instead of calling it P, he or she will call it Q. So this is a skill that is very, very important. And this has to do with brain, it has to do with visual processing. So once that skill of information processing is lacking, it could be as a result of so many reasons, it could affect learning. Also, form perception is also very important. Being able to determine the difference between one form from the other. Okay, you might cross 4 lines and then cross 3 lines and ask the child, and then different lines and ask the child or an adult to tell me identify this particular form in this out of all these forms. But I find it difficult to identify it.
A lot to be learned, really. You know, is something we just take for granted most times till it's very bad, and then we start running helter-skelter.
Yeah. So we have also visual memory, the ability to read with understanding. These are skills that are very, very important in learning. There are so many skills, but these are the basic ones that is important.
Well, that's a lot of skills to look into. But we're going on a short break. Let's take that in. And when we come back, we'll wrap up the program with the remaining topic for the day. Please don't go nowhere. Welcome back to Healthier You on Radio Maria 91.3 FM, the voice of truth. If you're just joining us, so we've been talking about our vision and its importance in learning with our guest, Dr. Damian Echendu, who is an ocular health and behavioral optometrist, and he's the past president of the Nigerian Optometric Association. And before now, we've talked about a bunch of things. He has told us the difference between vision and eyesight. And he has told us that eyesight is about the clarity that we see, but vision has a lot to do with organization, the understanding, and the direction of action. He has also told us about more than 75% actually of what we do involves the vision, and that it's more than the visual acuity, the 2020 we know about, or most of us we must have heard of. And just before the break, he was telling us about the various skills, the visual skills that are required for good vision to take place. And he told us about the eyesight, the teaming skills, which is the ability of your eyes to coordinate and work together, the focusing skills, the tracking skills, the perceptual skills, and the visual memory. So we continue our topic for the day. And Doctor, I think there's something that we need to clarify, and I think you will help us with that. I think that sometimes listening to based on what you've said so far, I think this thing could easily be misinterpreted to be like learning disabilities. Do you think that people can confuse learning-related problems due to vision to like learning disabilities? Do you think it's something that happens?
Yeah, well, anyway, learning disability is quite different from learning-related vision problem. Although at times some patients can be identified as having dyslexia, one of these vision disabilities that we'll call dyslexia. Some patients can be identified or can be tagged as dyslexic when actually is a vision problem they have. Dyslexia has to do with phonetics awareness and language, use of language. I mean, the ability of the brain to link phonetics and language. is a neurological problem, but it's quite different from learning-related vision problem. In learning-related vision problem, which I have just mentioned, some of the skills that once they are deficient, they can lead to learning deficiencies. So, but you find out that some of these children that goes to, or even adults that goes to clinic to go and have their eye checked, and in the process, if some of these skills are not checked, they can be tagged as dyslexic for the fact that they cannot actually pronounce words, for the fact that they cannot actually read the words, they become dyslexic. But once the necessary skill tests are done, you might find out that it's actually a vision problem. Some parents don't even take their children to eye clinics to have their eyes checked, for the fact that they cannot talk, speak coherently. I have had cases in the past, and it's just refractive error that is making the child not to perform well in school, that is making the child to be hyperactive. So some people call hyperactivity syndrome. Some parents or some even clinics attack children as hyperactivity deficient syndrome, and then and once that tag is done, they might be giving them drugs that are not really, the child might not really need, when ordinarily the problem is just vision. And once the appropriate test or the specific test is done, some of these things can be detected, and then the solution will be given for that child. And once the child starts seeing very well, start making use of the vision, all the skills that is required, you find out that the child academic performance will improve. So they are quite two different things. Yeah, learning disability, vision problem cannot cause learning disability.
Okay. Okay.
Vision problem, I don't know whether you get me clear.
Yeah.
Vision problem cannot cause learning disability. Because it's a neurological thing, it's a brain deficient mechanism or deficient information processing in the brain that leads to vision disability. So it's quite different from learning-related vision problem.
And over the course of this show, you've talked about the tests, some of these tests that you're meant to do, and all of that. Are these tests readily available to us in this part of the world?
Yeah, well, just like I said, it's not all eye care practitioners. The behavioral optometrists are well trained to carry out some of these tests. Although in our training as primary eye care providers, some of these tests are taught, but you find out that in practice, you find out at times, because of the procedure that is required, most practitioners don't engage it. So, but you find out that those that have specialty in that area, behavioral optometry, they actually make sure that children that have learning problems due to their vision, such tests can be done and properly done. And if you check around, you find out that some clinics that have such qualified personnel that can carry out such tests.
Okay, at least that's some solace, because what we normally hear is that we don't have the equipment readily available or stuff like that, especially in this part of the world.
But the thing is it readily available?
Yeah, the equipment is not that expensive, it's readily available. Even some of them have been produced in Nigeria.
Yeah. Because most times even do the normal eye check is already very expensive.
Okay, that's a good one. So now let's talk about, are there risk factors to development of these learning-related vision disorders? Are there risk factors for it?
Yeah, of course, there are risk factors. One, it could be congenital. It could be something that is genetic, something that a child is born with. Okay? And in such way, it could be a familial problem. If a pregnant woman smokes or drinks excessive alcohol, it could actually lead to affect the baby in the womb. And when the baby is born, the vision development the vision would have been affected and the development will be very poor. So that could be congenital. If a woman takes a lot of drugs, it could also affect
drugs
vision.
Adverse
effect. Yeah, it could also cause adverse effect and then of course affect the vision. Those are congenital ones. Other ones that could actually other problems or some of the risk factors include simple refractive errors.
Okay.
Refractive errors like myopia, short-sightedness.
Okay.
long-sightedness,
Stephen,
or
why are you laughing?
Okay, you don't bring me to
Why are you laughing?
this. Please don't bring me into this situation. I've heard enough of. I went for my eye check like was it 2 weeks ago, and what I heard. So please don't bring me into this situation. I don't want to hear more.
Okay, hyperopia, for instance, which is long-sightedness, astigmatism. Okay, and then of course.
Okay, sorry, Doc. These things can be congenital.
Well, it could be if a parent have refractive error like myopia. There are high chances of also transferring it, a child having it. It could also it could be congenital. It could be inherited from the parent. A child could also develop it as the eye is developing. Okay, so it depends on how this child. The parents were able to develop. Can be able to get this child to get their vision to well develop. Before I forget, it's very, very important for parents to know at least when a child is born, there are basic things they need to do in order to get the child's vision to be properly developed.
Okay, what are some of those things?
Well, for instance, in the crib, try to move the infant, try to move the child from the crib, move him around in the crib.
Okay.
Hang some mobiles.
Those
toys. Let the child be able to sit and play with it.
And focus.
It directs action. It directs, okay. And then when the parents or mother moves around, let the mother also talk.
Also observe
talk to the child. Observe the child. Also
because
talk.
At times, sorry, Doc. At times you notice that when they play with those, when you move those toys, they follow the movement of that pendulum of that toys. So parents should be able to observe more and not just take those things for granted.
Yeah. So in the process while doing this, let's say be able to look at the eyes and see whether the two eyes are really moving together or whether one is moving differently, the other one is moving different. Because for a child to look at something and see it properly, the two eyes must come together. And also when they look at this, they should go out together. So there's a particular age, let's say.
So sorry, Doc. When we say come together, and how do they even know that the child's both eyes are coming together to see something? You understand? Because we've been here saying watch the movement. And at times we may not even be able to decipher, okay, is it actually coming together or one is going like that or the other one is going like that? Yeah,
when you see when you see a child or even an adult that the two eyes are not working as a team, it's really easy for you to notice that. You see one eye, you see the black eyes, you see the position in the eyes.
Trying to observe yourself. That's what I'm actually doing.
Look at the black eye, okay? Look at the white one here. Look at the white one here.
Yes.
You see, you compare the two. They are almost the same size. Look at the white one in the middle.
Yes.
They are almost the same size. So you find that they are looking. I'm looking at you. You find that they are straight.
Okay.
The situation where the white here increase, move, and you are straight.
Okay, I'm understanding it better now.
So also there's a concept of, I think,
if you hadn't brought this to our knowing, all we just know is that the child just sees the thing moving and it just follows. So it's now we are seeing that when you see both eyes are
moving and going out and looking symmetrically.
So when we talk about the children, while we're doing the research, I came across a concept that I think they call gaze tracking.
Yeah.
So what is that about? Because first of all, saying something about a child being able to gaze track.
It's the same thing I said earlier about tracking. Okay. Following targets, following objects, following words, for instance. Let's say, for instance, a mother moving around. As you move, you talk to your child. Okay? Play with your child. Hide and seek games. Some of those things are very important. As you talk, you find that the child will follow you. Okay? And let's say at 3 months, a child's eyes should be moving. Should be moving without necessarily moving the head so much. Okay? So those are things that a mother should look out for. Okay.
So that's gaze tracking.
When let's say
the gaze.
Let's say for instance at age 6, if a child or you ask to look at something, instead of looking at that thing straight without, you move his head before he sees it. That's a problem.
Oh wow.
I'm actually happy this topic came about because on Sunday, I think just last Sunday, I was somewhere and the teacher was complaining to the parent that the son is complaining that I think maybe the boy will be reading, and at some point, kind of like everything is just. He has lost focus. He's now saying that he cannot read.
Yeah.
Is that part of the vision problem?
That's a vision problem. You see, let me give you an instance again. A child, let's say at 4 years, you ask a child to look at something over there and read it as he's moving. If the child cannot read it or see that very before as he's moving, and he has to stop to read it, there's a problem.
Oh, wow.
Okay? And you find out in some schools, a child, instead of children will be in the class, others will concentrate and be reading and be understanding what the teacher is saying. You see the other one playing. Why is that one playing? You might think the child is stubborn. It could be because if the child cannot see what you are writing on the board, how would the child pay attention?
Okay.
That's a good
You give a child something to write, instead of writing, you'll be going off the book. Or you see a child in the class, or you see a child in the class, instead of keeping the two eyes open to read, instead you try to close one eye and to see something. There's a confusion there.
Somewhere.
That means that the two eyes are sending different information to the brain.
Yeah,
So in order to see better, see single, all he has to do is to close one eye so that otherwise he can focus. Otherwise, it will slow information processing. And you give a child the assignment he will do finish in 5 minutes. It takes the child 1 hour.
This is a very serious issue that we have.
It takes a child 1 hour to. You've not asked yourself why is other children of his or her age can do this so fast and then this child is sluggish.
In this part of our world, I'm sorry to say, such a thing, I don't think you would think that far of, is it, what's wrong with it? And the next thing, logical is to beat the child.
Go focus, you know.
You beat. The teachers do it a lot.
Yes.
And
you're always distracted, always playing, always.
Yeah, we do go to schools to talk to teachers, to train them on how to detect some of these problems. Because ordinarily, teachers, they're always with their children. And yes, 2 days ago, I saw a child, I think about 4 years. It was the teacher that detected it and said, this child, others will be copying. He will not be copying, but when you bring the papers and give him, he'll be copying. Not up to 4 years.
Okay.
When you bring the paper to close and give him, he'll be copying. But when he's writing on the board, he cannot copy. If the child is in front of the class.
Wow.
Okay. So how do we
So we are talking about some of the risk factors. I've mentioned refractive error, myopia, short sight. Also, we have strabismus.
Okay.
Strabismus or squint is the deviation of the eyes. It is permanent deviation of the eyes. You see one eye go differently, the other one is straight. One eye is looking at you, the one is looking differently.
Can we now say that is the 4:30 we have been hearing?
Yeah, it's 4:30. The so-called
the
so-called 4:30.
Okay.
Okay. So this also needs to be, you as a mother, you should look out for that. Okay. Once at the age of, as the child is developing, you find out that at the age of 6, the two eyes are not straight. They are not. Please make sure that because if left like that, it can lead what we call amblyopia, which is also under learning retarded vision problem.
Oh.
Amblyopia, yeah. And when amblyopia develops, there's nothing you can do to remedy that vision, because you look at the eyes internally, nothing, you won't see anything wrong, but because the brain has not been fully developed. Because once the two eyes are not working as a team, one eye will be suppressed, and that eye that is suppressed will not develop.
No. Yes.
One will develop, one will not. So once that takes place, you find out it will be very difficult. So that is why once there is also refractive error, let's say you have a different refractive error here, maybe -4 myopia and +4 hyperopia here. You find out that the child might be using one eye to see at distance and using one eye to see at near. Or we will have the same myopia or hyperopia, let's say hyperopia in the two eyes, but one is higher than the other. One is sending different image, blood image to the brain, the other one is sending sharp image. That one that's sending sharp image, the brain will pick it and ignore the other one, and that one will go out.
Okay, so that is another reason why we beg people that even when you go to get your eyes checked and they give you glasses, please wear it so that you will not suffer your eyes.
Yeah, of course.
So, doctor, just in 1 minute, because as you can see, our time is fast spent. Can you just walk us through treatment options for these learning-related vision disorders?
Yeah, well, I've just said it before. Learning-related vision disorders depends on what caused it. If it's refractive error, it could be corrected early enough with lenses. If it's tracking, focusing skills, accommodative problems, if it's convergence or divergence problem, it could be addressed with what we call vision therapy. It could be addressed with what we call vision therapy. Okay, and there's a trained optometrists, the behavioral optometrists that can do that. Okay? Okay, yeah. So for those visual skills, once it's lacking, it could be ameliorated, it could be trained, the vision could be trained to see better and to perform better through what we call vision therapy.
So I think one of the important things he has mentioned is that vision is learned.
Yeah, vision
Yes.
is learned.
It's like a life process.
Cognitive
Yeah.
factor. It's a cognitive factor.
Yeah.
Okay, so Doc, you have really done a great job to vision and learning. You know, when this topic first came up, we were like, vision and learning. But today, now I understand the importance of vision and learning. Doc has gone, if you are just joining us again, in the studio with us is Dr. Damian Echendu. He is a seasoned optometrist and ocular and behavioral optometrist. He has done justice to this topic, vision and learning. He has told us the difference between vision and eyesight. He says eyesight is just clarity, you're seeing these things, and vision is being able to understand, direct, and organize. That's bringing everything, all your cognitive factors, bringing them together to be able to actually focus and see. Okay, so he has taught us the different skills they check in visual learning, the way the teaming skills, which is the ability of the two eyes to
work together
in a teaming way, vergence, and come together and work as a team. Okay, focusing, the eye being able to focus on something and be able to read it, to track it, like you move something to a distance and the person is able to like read through the line and see what is actually going through, perceptual skills, and all that. He has really done a great job. He has said the risk factors, we have the genetic factors, can also be our lifestyle, and also from birth also. Mothers, when you're pregnant, please be mindful of what you take in, because I think in this studio, most of the congenital diseases we've talked about, we always relate it to is either the lifestyle of the mother.
Yes.
When carrying the baby. So please, we're still saying it again that when you're pregnant, you don't just walk in and take any drugs or do what you like. Just be mindful of adverse effects of drug. Doctor, thank you so much. We have learned a lot today, how vision is very important in learning. And please, parents, if you're listening to us, Children's Day just passed, and we deemed it necessary to actually bring something on the children. Doctor actually said he wants to talk so that the children, parents can also look at their children and know what is lacking. So please, if you have not done that before, watch your child's eyesight, watch his vision, watch the way he's watching the television and everything. Just observe and then know how to give immediate help to your children. Doc, please just give us a line before we end this program because our time is fast spent.
Well, I would say for parents, I would advise I give parents, get their child's eye checked as early as possible. And if you're in doubt, take your child to the eye care practitioner, see an optometrist, see an ophthalmologist, and to get their eye checked. And then also, as much as they are developing, especially when they are born, try and involve them with some of the activities, visual activities that will help to develop their visual skills. Okay?
Okay, and that's our package on the show today. Dr. John Streff says that when vision is working well, it guides and leads in all that we do. When not, it interferes. And as the doctor said, when in doubt, see your healthcare professional. How Dare You broadcast every Tuesday by 4 p.m. right here on Radio Maria 91.3 FM. Do make it a date with us same time next week. And please stay tuned to Radio Maria 91.3 FM. Child protection will be coming your way in the next few minutes. From Stephanie and I, we say, do enjoy the rest of your evening.
Thank you.